Hi, my name is Geraldine Campbell, and I've been asked by the library to give a little talk on the nature of bibliotherapy and stroke poetry therapy. So I wonder, and I'm a poetry therapy practitioner myself. So in order to talk about bibliotherapy, poetry therapy, I decided the best way to approach the subject was to try to look at the concept as objectively as I could. I therefore decided to ask myself a number of questions that someone might ask if they wanted to find out more information on the subject. And I've used a question and answer format, and I hope that this will shed some light on the nature of bibliotherapy, poetry therapy. So, the first question: what is bibliotherapy? Bibliotherapy is the use of books and literature as a therapeutic means of maintaining good mental health. It's non-pharmaceutical. It's a non-pharmaceutical treatment offered as psychological support, and it can be described as the process of reading and reflecting and discussing a piece of literature or poem chosen by a trained bibliotherapist, poetry therapist, to bring about a shift in thinking. So the whole idea is that having read the piece of literature and discussed it, we then hope that the person will have some kind of a shift or maybe, a change in their thinking. So the next question then, what is poetry therapy? So poetry therapy has been defined as a distinct professional field, a sister profession to the other creative arts therapies, that's art, dance, drama, music, and psychodrama. Now, and that definition comes from Chavis and Weisberger, who would have been mentors of mine in the distant past. Then I have another one: poetry therapy, as one of the expressive arts therapies, includes attention to verbal and non-verbal behavior, language, symbolism, use of sensory modes, vision, order, and balance. That one is by Nick Mazza, and this third one is also by Mazza. The purview of poetry therapy includes bibliotherapy, narrative psychology, metaphor, storytelling, and journal writing. So they're the explanations as to what is bibliotherapy and what is poetry therapy. If somebody asks me the question, are you a bibliotherapist or a poetry therapist? I have to say I'm both bibliotherapist and poetry therapist. And the reason for that was that this originated in the United States. And for a long number of years, there was a lot of debate going on as to whether when someone had completed their training, they were a certified bibliotherapist or a certified poetry therapist. So finally, after someone had done their training, it was decided that they would be a poetry therapist. So the International Academy of Poetry Therapy, that's based in New York, awards the credential of poetry therapy practitioner. So a poetry therapy practitioner can work with clients in groups at two different levels. They can, if they are already accredited as a psychotherapist or a counsellor, work at clinical level for issues such as depression, anxiety, bereavement, etc. And couple counselling, if that comes in. They can work with mental health issues. A poetry therapy practitioner who does not have a clinical qualification might have a qualification in creative writing or art therapy, or might be a writer or a poet. So people have come from different backgrounds and they have qualified as poetry therapy practitioners. They will just work, it's not just work, they will work at developmental level with clients and groups. and they can lead personal development groups, building self-esteem groups, and they can facilitate support groups. So they do the very same as the clinical therapist, but just at developmental level rather than clinical. So they're not dealing with severe mental health issues. So where did it all start? We have to kind of go back to the ancient Greeks, and Apollo, the god of medicine and poetry, is credited by a number of writers as providing a historical context for the foundation of poetry therapy. The ancient Greeks understood the importance of the links between words and feelings to poetry and healing. Aristotle, in his essay Poetics, mentions the role of catharsis in bringing about an emotional cure. So catharsis is a Greek word for cleansing. And that is what we do today through literature and poetry and writing. We help the client to release feelings that may have been suppressed. And we have learned that there is a link between the material used and the strong emotional impact. Psychotherapy today understands the role of catharsis as a principal factor for emotional healing, particularly in the area of trauma. And the use of chants and incantations by primitive healers and shamans was perceived to have magical qualities by tribal members. The power of words having curative functions is mentioned by Astroff, that was 1962, in her book on the American Indian. And she states, "It is not the herb administered to the sick which is considered the essential part of the cure. Rather, the words recited over the herb before use." So medicine men and witch doctors understood the magic of words. So how did the model develop? Right, so we could look at the foundations for the model began in Pennsylvania Psychiatric Hospital, and that was back in 1843, believe it or not, when the hospital newspaper, it was called The Illuminator, it's a very good title, began publishing poems and prose pieces written by the patients. So what they found that when they wrote something, submitted it, and it was accepted, the patients seemed to undergo a change, and they became quite enthusiastic and livelier. So that was the effect that writing literature, writing poetry, writing prose had on them. It was the fact that, yes, they were inpatients, and we can only begin to imagine what life was like in a psychiatric hospital back in the 1840s. So when also in the 1800s, Benjamin Rush recommended reading and poetry for the mentally ill. Robert Graves in 1922 recommended that a well-chosen anthology is a complete dispensary for the more common disorders and may be used as much for prevention as cure. So that was his opinion. Then in 1925, psychiatrist Robert Schaufler published a book entitled The Poetry Cure, a poetic medicine chest of verse. And then a further publication by Schaufler, that was in 1931, was titled The Junior Poetry Cure, a first aid kit of verse for the young of all ages. So this book actually provided a classification of poems best suited to treat 14 common complaints presented by his patients. So he actually listed out the poems that suited the complaint. So that was it. That was poetry therapy in action. So another very important piece of the picture were librarians. This is in the United States still. So in the 1940s and 50s, were very much part of the bibliotherapy movement. They not only dispensed books, but also arranged for the facilitation of bibliotherapy and poetry therapy groups. These groups met on a weekly basis using public libraries as their base. And it's also so true to say that librarians are still wonderful. And during lockdown, we were blessed to have them because they kept housebound people supplied with books, which is important for mental health. So the current model we use today has its roots in psychiatry, psychology, psychotherapy, and the public library system. So, question, what is poetry therapy? So this comes basically from, who have I got? Sorry, just bear with me. I have the reference at the end anyway. So what is poetry? What is poetry? Poetry therapy. It's an interactive process where clients integrate their emotions with their cognitive responses. That means it provides a stronger connection between words and feelings. That's all, simplified. It is a defined discipline within other expressive therapies. It uses words to therapeutically access thoughts and feelings. As with positive psychology, it appeals to the healthy aspects of the mind. It reinforces clients' strengths rather than focusing on their weaknesses. The use of image, metaphor, and symbol help clients explore their inner life. If you take the symbol of a flower, for instance, people usually associate the image of the flower with beauty or love. So that's how symbols can be used. What do we call it? Realia, that's the word. You can use symbols, and people will choose one of the symbols that are put out on the table and hold it for a little while, and then they're asked to write about it and to write about what has come up. And it's amazing where it actually goes. So that's the image. So the interaction, we're still on what is poetry therapy. It's the interaction with the therapist and other participants that's part of the process. It can be used with clients who have little or no knowledge of poetry. It's a universal language. It transcends status in society, skin color, beliefs, and religion. It's like music and art. It goes beyond the personal into the universal. It's also been seen as very useful with marginalized people who have suffered injustice, and also the homeless, people in recovery from addiction, domestic violence, and trauma survivors. So there is empirical evidence there. So next question, what are the goals of poetry therapy? So I have four goals here. 1, to improve the capacity to respond through stimulating and enriching mental images and by helping the feelings about them to emerge. So basically, when we're listening to a poem, like maybe a nature poem, we start to think about the images start to come into our mind, and we think about it, and you start to kind of feel more relaxed. So you're actually reacting to those images that are being written about in the book or the poem. The goal 2 is to increase self-understanding by helping individuals value their own personhood and become more knowledgeable about self-perception. That's fair enough. Goal 3, to increase awareness of interpersonal relationships. And number 4 is to improve reality orientation. So That's written by Hines and Berry. That's one of the standard books that we would have to read when we're training. So what are the tasks of poetry therapy? I have actually 8 of them listed here. So identity and identify. Number 1, identify. So it's finding oneself in the poem, and that's about the self and compassion. Number 2, explore. That's about sharing and exploring feelings and those of the other group participants. So that takes courage. So that's what, that's one of the tasks. Create. So you're creating something new through writing. That takes imagination. Compare. You're considering the views of others. That needs empathy. Insight. That's new learnings, realizations, insight, a new idea, thought, or reframing. So that comes under NLP, neuro-linguistic programming. That's just another therapy. Action. Helping a client connect with thinking and doing. So that's CBT, cognitive behavioral therapy. The integration of learning into positive and healthy change. So that's integrative therapy. So now the next bit then is just a 7-stage model. So it's again it's not about it's the tasks and the goals. So it's 1, to use poems and literature in order to help people express themselves, to see and feel current experience through the lens of poems and words, to give a voice to the unexpressed, love, hate, hurt, trauma, joy. There's stuff that is that's the stuff that's hard to talk about. To take the client beyond their own awareness into connection with others. To help individuals process thoughts and emotions. To put ideas, fears, and dreams into words. To hear your own work and the work of others in a safe place, and to improve self-esteem. So the next bit could probably answer, how does it all work? So the question here is, how is it facilitated? Well, let me just explain how a poem or an article might be used in a group setting. Firstly, a theme or topic is chosen. This could be anything from managing anger, low self-esteem, physical health issues, self-exploration, or feeling stuck or overwhelmed. The facilitator will choose a number of poems that is relevant to the topic. It's very important that the chosen poem is suitable and relevant to the theme. I'm just going to mention one here. It's The Armful by Robert Frost. And it's a very useful, universal type poem that you can use when people feel overwhelmed or are generally stuck and can't seem to find the motivation to move on, or they don't know which way to turn, and they've got so much in their armful that they're trying to kind of keep all the balls in the air and it's not working. So that's a poem that we can use. So a typical group session would begin by a reading of the poem. Sometimes I ask people to read one line each, and we go around a number of times till the poem has been read at least 3 times. Sometimes I would ask different participants to read the whole poem. It's then read together as a group. This allows for the words and the rhythm to flow. Through repetition, the poem's message is being absorbed in different ways. I might then ask the group if there's any one line that stands out for them and why. So people provide different reasons for their chosen lines, And the reading of the poem together and the dialogue around this allows for expression. And that's what we're asking people to do when they're writing their feelings that have come from listening to the poem. So I might then ask someone to write, I might ask everyone to write a few lines using their chosen line to start the piece of writing. The writing can be in prose or poetic form. The most important point is that when people write and choose to share their writing, we're in the process of reflection. We are not there to critique what a person has written, and we're there to listen to the feelings and emotions that are expressed in the writing. The poem is really only the vessel that elicits the different responses. In a similar vein, we can use different books, asking people to have read a certain chapter before they come to the group. It's similar to a book club, but there is the therapeutic element. And again, the choice of book is important. So I remember when I was facilitating a recovery book, and it was like parents whose maybe their adolescents were in recovery. So it was a sport group. So I chose the book Rachel's Holiday, and that was Marion Keyes, and because it deals with addiction in a sort of a light-hearted way, but it's very serious underneath, and the impact that the addicted person can have on the family system. So that was one of them. So you don't necessarily have to choose a heavy theory book. You can also look at lighter books as long as the subject is being covered. So I hope that if someone ever says to you, now, do you know anything about bibliotherapy or poetry therapy? You'll be able to say, well, I do actually. Would you like me to tell you all about it? So I have here The Armful by Robert Frost, and I'll read it, and then I've got one other one. And the reason I just picked, as I said, the reasons for picking that because we all get stuck at times and we all get overwhelmed and life is very busy. So this is, you can sort of, if you listen, you can sort of see this poor guy in the middle of the road. Anyway, for every parcel I stoop down to seize, I lose another off my arms and knees, and the whole pile is slipping. Bottle, buns, extremes too hard to comprehend at once. Yet nothing I should care to leave behind. With all I have to hold with, hand and mind and heart if need be. I will do my best to keep their building balanced at my breast. I crouch down to prevent them as they fall, then sit down in the middle of them all. I had to drop the armful in the road and try to stack them in a better load. So it is kind of visual, and you can see him trying to sort out all his parcels. So when I am using, I mentioned how we might use it, but we could also use that poem and ask people to look at what's in their armful, what is currently in their armful, and to name all the things. Maybe it's work, maybe it's study, maybe it's an elderly parent or something. And it's really trying to look at the time that you can give to each of the things you've named. And sometimes when people look at their armful and they do a sort of a timetable on their day, and they begin to see that they're not going to keep it up, it's too much to carry. So it's deciding, well, what do I need to hold on to? and what can I let go of? And so that would be one of the ways that we would get people. So you'd have you could have a balance sheet, like, so you've got the positive on one side and the negative on the other, and and there could be positive and negative in both sides. So anyway, that's how I would get people to work with that poem. So the second poem that I have here is a poem. It's called Autobiography in 5 Short Chapters by Porsche Nelson. Now, this is one that is often used with groups, or with people with addictive behaviors, or people in recovery who are trying to maintain a sober life. It's also another way of looking. Why do some people continue to make the same mistakes over and over? So this is written by Porsche Nelson. And when you think about it, it is an autobiography, and it is in 5 little chapters. So like it's basically, it could take someone years to get from chapter 1 to chapter 5. So some of you might know this. I walk down the street. There is a deep hole in the sidewalk. I fall in. I'm lost. I'm helpless. It isn't my fault. It takes forever to find a way out. I walk down the same street. There's a deep hole in the sidewalk. I pretend I don't see it. I fall in again. I can't believe I'm in the same place. But it isn't my fault. It still takes a long time to get out. I walk down the same street. There's a deep hole in the sidewalk. I still fall in. It's a habit. My eyes are open. I know where I am. It is my fault. I get out immediately. I walk down the same street. There's a deep hole in the sidewalk. I walk around it. I walk down a different street. So that's basically the autobiography in 5 short chapters. And I'm sending this in to Magella. So there's some prompts with this one. So like if someone wanted to use it or make contact, it's like, is there a habit or behavior you would like to change? So this is all about writing. Can you explore why you've chosen this particular habit or behavior? What do you think it might feel like if you stopped or changed this habit? Is that something that you would like to do? What way might you change it, or what new ritual could you incorporate into your daily life that would be helpful? So there are just some of the prompts at the end of the poem. So thank you very much for listening, and I hope that you got some enjoyment out of it, and that you're now a little wiser on poetry therapy and bibliotherapy. I will send a list, a bibliotherapy list, a bibliography and reading list into the library as well. Thank you very much. Bye-bye.